If you're a cash-based physical therapist and you struggle with talking about money or plans of care with patients because you feel bad about delivering this information, then this video is perfect for you. My name is Dr. Garcia, and I help cash-based PTs like yourself overcome these obstacles so you can thrive in your PT business. When a patient is struggling with an ache or pain, they hire a physical therapist like yourself to solve their problems. Physical therapists struggle offering a plan of care or an amount of sessions that someone needs because they're fearful that that patient might negatively view them or judge them. So instead, they offer lower amounts of sessions because they don't want to be judged. In essence, they think of the patient's finances and not necessarily their outcomes. So the problem becomes that the patient doesn't get what they need and the physical therapist doesn't get what they want. So this is a problematic challenge for both parties. The good news is I can tell you there are easy ways to address this. Here are 2 strategies to develop confidence and quickly overcome this fear. Number 1, provide the patient with options. For example, instead of giving one plan of care because you're fearful of their view of you, provide 2 options so that they can make their own judgment. This will remove you from the equation and your feelings. For example, "Hi Mary, based on everything we've covered today and all of your concerns, I have 2 recommendations based on how aggressive or conservative you want to approach care. We can see you 3 times a week for the next 6 weeks, and this will expedite your healing so that you can get back to playing tennis with your friends again in the tournament. The second option is to see me twice a week for the next 6 weeks. However, this would potentially slow down your outcomes, but still put you in a really good place. Which option works best for you?" Now, these 2 examples give them the opportunity to be a participant in their care, and you don't have to feel like you're their financial advisor or you're thinking about their finances. Your job is to help people overcome aches and pains and improve their quality of life better than they can do on their own. That's why they hire you. They don't hire you to give them the lowest plan of care because you feel bad. Their goal is to live their best life. Your goal is to help them get there. The only challenge becomes that one sentence or that discussion about delivering what they need and what they want in one concise statement. This brings me to my second point. Make your plan of care concise. Most physical therapists will continue to talk because they feel that they need to justify what they have just offered. For instance, they'll offer a plan of care, and before the patient can respond with their preference, the PT has already continued to ramble on about why their care is the best for the patient at that price point. They don't let the consumer process what has just been said, so they continue filling in the void. Silence is a good thing, and it allows people to process. But because physical therapists feel bad and they have a hard time allowing silence, your plan of care or financial discussion should be in one statement that a 6-year-old can understand. For example, "Mary, based on everything we've discussed, I'm recommending for you to come in 3 times a week for the next 6 weeks. This will get you there faster. If you're okay with the slower process or not as much confidence going into that tournament, I'd recommend at the bare minimum 2 times a week for the next 6 weeks. Which do you want to continue with?" These 2 strategies will help you streamline your process with cash pay patients, feel good about delivering this information, and giving the patient the best opportunity to heal. You don't have to be a financial advisor, and you don't need to feel bad about what you do, but what you need to do is deliver this in a professional manner without feeling bad. So the next time you have an evaluation or a follow-up session with a cash pay patient, use these tips and watch your patient smile with that newfound excitement, and not the confused look when you were delivering a confusing plan of care that was bare minimum because you felt bad about their finances.